Hello everybody and welcome to the Thursday edition of Video Clips. And just one quick announcement, we have a really terrific package for people who are seeking health and love food. So lots of cooking classes and a women's health certification course and 12 months of personalized coaching. And so, and it's at a great price. You save over $1,000. And it doesn't matter where you are, all this stuff can be done by virtual classroom and at home and using videos and all that sort of thing. So any place you are on the planet, if you want to talk to us about a great package to help you enjoy cooking and food prep more, learn more about health, and get a little personal assistance too, just give us a call or send me an email at pampopper@msn.com. All right, I've chosen two topics for today that are important, and the first one is infertility, which has unfortunately become a big business in our country. I looked this up. In 2012, there were 165,172 procedures performed at fertility clinics. That's a bunch. And the failure rate's real high, 61,740 babies born. You can do the math. It's an expensive issue. It costs us billions of dollars. Now, why is this happening? Well, some people say the reason for the increased female infertility rate is women are waiting longer to have children, so they're a little bit older. Actually, not as older as you think. So in 1980, the average age of new moms was 22, and now it's 26. 26-year-old women should not be having trouble getting pregnant. Women in their 20s are in their peak fertility and reproductive years. The real cause is not the extra 4 years women are waiting on average to have children. It's that more and more women are overweight and unhealthy, which can cause infertility. Research shows that weight in particular is a factor. So one group of researchers followed 1,950 women in the Nurses' Health Study to look at the relationship between body mass index and weight gain in adulthood and then fertility. So at baseline, they got current height, weight at age 18, and then they were tracked every 2 to 6 months and asked about their progress in getting pregnant. Their weight gain was also tracked too. The researchers determined that body mass index at 18, weight gain after that age, and weight status in adulthood were related to infertility. For every 5 kilograms of increase in weight, there was a 5% increase in the length of time that it took to get pregnant. For women who were slightly underweight or who lost weight, the time went down, and so it was dose dependent. The bigger you got, the longer it took to get pregnant. Now, there are a lot of reasons why this might be the case. One is that we know fat cells pump out inflammatory cytokines and hormones, and those hormones are converted to estrogen in the bloodstream. So imbalanced hormone levels may contribute to this problem. Another one is that overweight and obese women are not healthy, and an inability to get pregnant may be nature's way of protecting the mom against becoming pregnant. And preventing at-risk moms from taking on the challenges. It's very physically challenging to carry a baby, deliver, take care of a newborn. So maybe this is nature's way of saying, hey, you better take care of some of these problems first. So women who are unable to get pregnant should be shown how to improve their health and weight status instead of being referred to a fertility clinic. And there's a great book about this you might want to read. It's called Passing the Pregnancy Test. By a great author. Her name is Kim Richards. She's joining our health provider group, and she went through this problem herself and wrote a book about her experience, and I think it's quite enlightening for women. I think if women looked at the side effects, the expense they know up front, they don't know the side effects of the treatment, but I think we could motivate a lot of women to take a more natural approach to getting pregnant, as in, how about I get healthy first and then work on getting pregnant, if they understood the side effects of those treatments and their failure rate as well. Okay, the other thing I want to talk about is Tai Chi. And I've never been a big practitioner myself. I have our Chinese partner well, she lives in Wilmington, Delaware, but she spends a lot of time in China, obviously. She does Tai Chi, swears by it. I took one class from her at a conference one time, and I enjoyed it very much. I've always said that what I'd like to do in my next life is come back as a professional athlete, and then I could just exercise, eat, and sleep, and then I could do all the exercise I wanted, because my biggest thing now, I probably would take this up too, except that I don't have enough time. All right, so I looked up some studies. I found one. It started with finding one that showed that in older Chinese patients, 266 older Chinese patients who practiced Tai Chi classes regularly, they showed reduced blood pressure, lower body mass index, and improved health-related quality of life. The classes didn't improve fasting blood sugar, cholesterol, or metabolic syndrome, and the authors rightly said future research should look at, quote, a combination of Tai Chi and nutritional intervention to reduce the level of biomedical risks. And so they were smart in basically saying Tai Chi is wonderful, but it's not a substitute for eating a healthy diet. What you have to do is both. But I also remembered having read a lot of research about the effect of Tai Chi on Parkinson's patients, and a growing number of studies are showing that Tai Chi can improve balance and significantly reduce the number of falls with just 3 sessions of 60 minutes per week. So my advice to early stage Parkinson's patients has always been to be aggressive about staying active, and particularly about taking Tai Chi classes and changing their diet so as to postpone disability for as long as possible, because it improves the quality of life of the Parkinson's patient, and it improves the quality of life, obviously, of family members who may be called upon to take care of the Parkinson's patient as the disease progresses. And by the way, this article is about Tai Chi, but just as an aside, protein, high protein diets, very bad for Parkinson's patients, because the protein competes with the transport mechanism to get drugs to the brain that are helpful for Parkinson's patients. So the more drugs you take, the more side effects you get, the lower the doses, the better off you are, etc. So a low protein plant-based diet combined with exercise and Tai Chi, really good for helping Parkinson's patients delay for a long time the progression of their disease. And then another group that benefits from Tai Chi is rheumatoid arthritis patients. Lots of studies showed benefit. I read one the other day that showed that in just 12 weeks, patients had improved lower limb function, improved overall physical function, better balance, less pain during exercise and in daily life, lower stress, increased body awareness, and more confidence in moving in general. I say this all the time, the human body was designed for movement, and sometimes I know people who are sick don't feel like moving, but it's actually the worst decision they can make. You might remember just a couple, 3 weeks ago, I was talking about the effect of exercise on cancer patients, showing that even with terminal cancer prognosis, exercise helped people live longer. So one thing that's good about Tai Chi is it's a very accessible form of exercise, even for people who have no history of exercising or have been sedentary for a long time, or already are showing some signs of impairment, for example, Parkinson's or rheumatoid arthritis. It's also a great addition to people who already have a great exercise program in place. And again, if it weren't for time limitations, I would probably take it up too. If it weren't for time limitations, I would take up another 100 things, because I'm one of those people, never understood how these people say they're bored. I always run out of day and I run out of week before I run out of things that I want to do. So this is something I'd spend more time on if I have time. Just so you know, I do have time to exercise. I make sure I do it almost every day, so I'm not a cop-out here. All right, so Tai Chi, great recommendation for people with conditions ranging from hypertension to Parkinson's and rheumatoid arthritis. All right, that's all for the week. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next Tuesday with more news.